I'm Dr. Richard Ellenbogen, coming to you from my new Century City offices. What's all this buzz nowadays that people are talking about fat grafting, transfer? What is fat grafting? Why do I need to have fat transferred from one place to the other? I've been performing fat grafting since 1978. In fact, I'm called the father of fat grafting. I perfected the technique so in most cases I can make the fat last in one procedure. I get very little revisional procedures. What is fat grafting for? What is it used for? It's used to create higher cheekbones, to fill in folds underneath the eyes. And many people have very deep eyes. It's used to make the eyes a little heavier. As a woman ages, her eye gets deeper and fat is replaced in there. There are folds at the bottom of the mouth. Certainly lips can be made larger with fat grafting. Sucked in cheeks can be fixed. The use of fat grafting is infinite, even in the hands, to replace bony hands in older women. The fat grafting is probably, to me, the thing that probably is closest to the fountain of youth that has ever come down the pipes. There are many variations of how doctors do fat grafting. It goes from the dermatologist who sticks a needle in your butt and sucks out some fat and injects it, or the procedure that I do where I set up a laboratory in the operating room to select and to wash and to centrifuge and select only the best parcels of fat which I know will persist and last. Also, it requires a tremendous amount of artistic understanding of the various proportions of the face, not to overdo it. So fat grafting has added a whole new dimension to facial aging or unaging, to recreate the shape of a face of 5 years or 10 years earlier, get rid of folds, get rid of deep eyes, build out lips, build out stronger jawlines on men, even build out chins and cheekbones. It has to be done by an expert who has a significant amount of experience with this. It has to be done right as an operating room procedure, selecting only the best parcels of fat from the fat that's extracted by liposuction, and it has to be followed very, very carefully to make sure that the fat does persist.